Just published May 27, 2025, the American Academy of Pediatric's newest clinical report on postnatal cord blood sampling, also known as PCBS. This report describes the evidence, safety, and methods for collecting cord blood after delivery. There are 8 key action statements and 7 summary points, so let's get started. Starting with the key action statements. For PCBS to produce optimal blood volumes, the umbilical cord must remain clamped after delayed cord clamping until PCBS is performed. If there is a need for admission laboratory testing, PCBS should be used in all infants. PCBS followed by research studies, if needed, and/or cord blood banking using the same or different phlebotomy sites can all be successful in most cases with discussion and planning prior to the delivery. In very low birth weight, also known as VLBW infants, PCBS should be prioritized over cord blood banking in most cases. PCBS can be used to obtain a reliable CBC with differential. Obtaining PCBS blood cultures similar to other blood cultures must be performed as an aseptic procedure. PCBS can be used to obtain a reliable blood type, direct antiglobulin testing, and cross-match. PCBS can be used to obtain genetic studies, and last, PCBS can be used to obtain reliable coagulation studies. On to PCBS summary points. PCBS collects neonatal blood and is a painless procedure that has been well studied and successful 95% of the time in obtaining admission laboratory studies. PCBS can be used to obtain a reliable blood culture, CBC with differential, blood type and cross-match, genetic and metabolic testing, chemistries, and coagulation studies. If it is determined that blood tests are needed at or shortly after delivery, PCBS should be the first choice for phlebotomy and can be used in newborns of any gestational age in the first hour after birth. PCBS is most commonly performed for infants being admitted to the NICU, early onset sepsis evaluations, initial and follow-up genetic testing, studies needed for infants with congenital anomalies, and deaths that occur prior to or shortly after delivery. For PCBS to be successful in obtaining optimal blood volumes for admission laboratory studies, after delayed cord clamping, the umbilical cord must remain clamped until PCBS is performed. PCBS facilitates obtaining larger blood culture volumes, potentially improving early onset sepsis pathogen detection compared to infant phlebotomy. And similar to obtaining blood cultures from any site, must be performed as an aseptic procedure. And last, PCBS for admission laboratory testing can be coordinated with research cord studies and cord blood banking. There may be deliveries where PCBS should be prioritized, for example, in VLBW infants, where it prevents hypotension, the need for vasopressors, blood transfusions, and potentially intraventricular hemorrhage. PCBS followed by research studies and/or cord blood banking using the same or different phlebotomy sites can all be successful in most cases with discussion and planning prior to the delivery. And there you have it. Make sure to check out the full guideline from the American Academy of Pediatrics and other related clinical decision support tools at guidelinecentral.com.